Hello. Lovely to meet you. I'm Dr. Murmurs, and yes. Alright. So, today we are going to be kind of generally checking you up. I understand that's what you're in for. Absolutely. Okay. So how we're going to do this today is we are going to be running through. So sorry, just a little bit flabbergasted. It's been a busy morning. So we're going to do a general health checkup. So we're going to ask you health questions, and then we'll be doing your, heart rate and listening to your lungs. And then Nurse Lauren is going to be doing your blood pressure. And I'll be doing your eyes and your ears. And Nurse Lauren will be doing your full body examination as well. If you have any, cuts and scrapes or anything you need seen to, that's the time where she can put some bandages and stuff on you, alright? Okay, so, are you happy with that at the moment? Yep. Do you have any questions for either of us? Okay. So Nurse Lauren is going to run you through some things just now.
Okay, so as we said, so each one, so you have the health questionnaire. The health questionnaire is just a series of questions about your health and also your family history, and then obviously your heart rate as well, and your lungs. We'll just listen to any discrepancies. Then your blood pressure by me, we'll just be listening using the mechanical method. Then we also have your eye check that Dr. Murmurs will do for you. And then we also have your full body examination, which I will do. I'll just check your full body for lumps and bumps and your scalp and things, just to make sure everything's okay. Then you'll have your ear assessment with Dr. Murmurs. So that just consists of looking into your ears and just seeing what's going on. So that is pretty much it.
Well, if you're happy with that, then we'll go ahead with it. So I will begin with your questions, okay? So let's have a quick look up here. You're alright? Okay. So where are we at? It's a very warm day today, so I'm a little bit warm. Are you too warm? Are you okay? Okay. Right. Health questions. Okay, so it's been a little while since your last checkup, is that correct? Yeah, okay, so I've got some health questions I would love to ask you today. So, can you tell me how you've been since your last checkup, just in general? Oh, actually, I better check. I think Nurse Murmurs did double check your details. Your name? Yeah, okay. I don't have your date of birth on here though. Okay, got you. Okay. So, sorry. Since your last, checkup, how have you been? Okay, and have you been taking any medication at all? I'm going to ask you a series of questions about your health, okay? So, have you had any issues with your eyesight,
whether that's blurriness, a change at all, seeing more floaters in your eyes. Have you noticed that, have you been feeling confused recently, or has people said that your personality's changed? Okay. Are you, your hearing, would you say that's normal? Have you struggled with your hearing at all? And how about sleeping? Would you say you have a normal sleeping pattern? Are you quite comfortable sleeping? No sleep disturbances, not waking up lots during the night or anything like that. Okay, and your bladder, do you find that it's normal? Are you having problems with leakage, or, needing to pee more or anything like that? And how would you describe your bowel movements? Would you say that that is all normal? Has there been any changes, any blood in your stools, anything like that? Okay, have you experienced anything like heart palpitations or had any pain in the chest area at all? Okay. Have you noticed any swelling, particularly of your lymph nodes, so under your neck or kind of in your groin? That sort of area tends to, flare up first. Have you noticed any kind of lumps anywhere like that? Any other lumps that you want checked out? Okay. Do you have any moles or freckles or marks that you're concerned about that you want us to check? Okay. Yep, of course. Nurse Lauren will be able to do that for you, no problem. Okay, have you had any other kind of pain? Have you had back pain, any neck pain? Okay. How about fatigue? Have you been feeling fatigued at all? More tired than normal? And has anyone in your family had any issues as of late? So that could be, being diagnosed with something new that might be hereditary that we need to consider. Alright. Okay, well that is all my questions. Thank you very much. Right, well, we're just going to now look at your heart. So I'm going to listen to your heart and your lungs, and Nurse Lauren's just here for observation at the moment. She's going to observe and note down the times, okay? And I'll listen to your lungs as well. Alright. Just breathe in nice and slowly, it's alright. Okay. I'm just gonna listen now, alright? Just keep breathing. Alright, and I'm just going to listen to your lungs now as well.
breathe in and out. Yeah, we keep going like that a bit. Yeah, absolutely fine. So you're absolutely fine. There's no problems there at all. Alright? Now I'm just going to make some notes while Nurse Lauren here is going to take your blood pressure, alright?
Alright, okay, so we're going to be doing your blood pressure. Is that okay? You're happy for us to take that? Right. Yeah, so what I'm going to do is we're going to use this here. And I'm going to put this around your right arm. Get it right bicep type thing, okay? And I'm going to listen using this, and we'll do it 3 times, okay? To make sure that, we get like an average of your blood pressure. Sometimes the first time it can be quite high because you're like a little bit nervous about a new sort of procedure. But yeah, everything should generally be okay. Alright? So just sit there nice and comfortably. There's nothing to worry about at all. I'll get this set up for you. Nice and comfortable. Okay, not too tight. It will get tight when we do this, okay? I'm just going to put the stethoscope on. Got my meter reading. Alright. Let's tighten. Alright, and we're just going to release. Okay, let's go again. Alright, you ready? Nice and tight. I'm just going to release. Okay, and one more time. Alright. Let me just get that off. And then let's get this off you, okay? Just hold your arm out like this. Relax. It's all good, wasn't it? Right, so we'll just wrap this round. Of course. So, your average was pretty bang on, I have to say, for somebody of your age and, your kind of health and your weight. So I don't think we've got any problems at all with you and your blood pressure. So it's absolutely fine, okay? Now, right, let me move this here. Okay, so Murmurs going to come back in and check your eyes for you with a few eye tests. Alright, and I'll just keep over here. Right, okay, so we're going to do your eyesight. Okay, so I've got a couple of things here. We're going to do the colourblind test along with your eyesight, and I'm also going to have a good look in your eyes, if that's okay. Alright. Okay. Right, I'm just gonna have a quick examination, okay? So just look at me, that's it. Okay, so if you just look up and down to your left and to your right. Look up again for me. And look down to your left, to your right. Okay, and just gonna come in and out. In and out. In and out. Alright. Okay, and now can you just follow my finger? Just follow with your eyes where the finger goes. Can you let me know when you can see my finger and when it comes into your field of vision? Okay, just nod. Yeah. Okay, and then just follow my finger as it goes in and out and in and out. Alright. Okay, so we're going to do the eye chart. So I'm just going to hold this. Probably got this like this. Is that okay? Can you see that properly? Alright. So I'm just going to point and I want you to read all the letters from the eye chart, making sure this is the right letter. This one is for 1 meter. Alright. Okay. Yep. Okay. 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 Alright. Okay. Yeah, can you get anything on the line below? Just take your time. Yeah, you're doing alright. Excellent. No, I'm quite happy with that. Right. You don't have any glasses or anything, do you? No, I didn't think so. I forgot to ask you that. I mean, you're not wearing any, so I assume not, but all is good. Okay, so we're going to do the colour blind test. I'm going to show you a variety of different shapes and colours, and I want you to tell me what you can read. Some of them are very hard, not going to lie. So don't worry if you're struggling. The first one, what number is that? Very good. What number is this? Okay. What number is this? Just take your time. Alright. What number is this? Okay. What letter is this? Very good. What letter is this? And this one. Very good. What shape is this?
And what shape is this one? Very good. Okay. I'm pleased with your results. You did really, really well, so I'm happy that you are not colourblind since our last appointment. Now, so Nurse Lauren is now going to do your full body check, and she'll check those moles and freckles and let me know if there's any issues. Alright, so I'll be back shortly. Okay, so we're going to do your full body check, alright? Okay. Just checking there to make sure that I know what I'm doing. I'm a little bit new to this sometimes. Right, I've got this here, first aid kit in case you need anything seen to. So, do you mind if I touch? I'm allergic to the gloves, which is why I don't have any gloves on, but my hands are perfectly clean. Alright, so I'll just come over here. I'm just going to start feeling your face. Alright. Okay. Yeah, now, Grace, you will get your ears done shortly, but I'll just have a quick feel around your ears as well. Okay, so I'm just gonna feel around ears before Dr. Murmurs is in. Alright, and I'm just gonna give your scalp a really good examine and feel. Sorry about the noise, I've got a creaky floorboard here in our doctor's office. So frustrating. It's a nice day as well. I feel like everybody's out with their lawnmower. Dear oh dear. Do you plan to go and lie in the garden when you get home? Well, it's a nice day. You might as well take the best and most advantage from the nice day. Okay, I'm just gonna up here. Okay. Here. Can't really feel any bumps at all, if I'm honest with you here, so I think that should be alright. I'm just gonna feel down your kind of neck area and then your lymph nodes. Yeah, they're okay. Feel down. I'm just gonna feel across the tops of your shoulders. Down. I did see this. Your arm, are you okay? What did you do? That's a sore cut from this morning. Yeah, of course, I can pop a plaster on that for you. That's no problem. We'll get that cleaned up for you. When did it happen? Just this morning. Okay. Right, I'm just going to feel down. Do you mind? I'm just going to gently push on your abdomen. Just let me know if it feels sore at all, okay? I'm just going to gently. Alright, then we're just going to down your legs like so. Alright, now do you have any sort of like moles or things that you want me to check? Where? This one. Okay, let me just have a look. It's underneath the hair. Okay, let's see. Oh yeah, I see what you mean. Okay, well what's really important is it's all one colour. It's not changed as colour as it. It's even, there's no spreading, it's got even borders. It feels quite nice and smooth. I think that's okay. I think it's literally just a mole. Just a little mole. Right, well I better pop a plaster on you.
Let me have a look. I'm just going to use this alcohol prep pad first of all. It's like a kind of antiseptic wipe. Just gets if there's any dirt. Okay. Okay. And then let's pop this on, okay? Hold your arm out for me. That's it. Just stick on like that. Is that okay? Yeah, perfect. Alright, okay, that's you done there. I'm just gonna hello. So Dr. Murmurs is coming back in here to do your ear examination, alright? So enjoy, I'll just be over here. Okay. So we're just going to assess your ears. Right. First, what we're going to do is I'm going to look into your ears, and then I'm going to use the tuning fork to see if your ears, are picking up the sounds we would expect them to. And then if there's anything that I need to clean out of your ears, I will do that as well. Is that okay? Great. I'm going to start with examining your ears with this. I'm just going to come over to this side first, and we'll just have a good look in here. Looks okay to me. I'm just going to look in this side as well. Alright, so that one's also okay, but I have to say there is quite a bit of wax build up in both, so it might be okay, might not be disturbing your hearing yet. So we'll see what your hearing's like with the tuning fork, and then we might need a bit of cleaning that out, okay? So this is the tuning fork. So this is a 256C tuning fork. So what I'm going to do is I'm going to hit this and I'm going to move it around your head, and you just need to let me know when you can no longer hear it. Okay? Okay. One more time. Okay, so I do think you were hearing most of it, but I think if we just clean your ears out, then you'll hear a little bit more, okay? Alright.
your ears fixed. Okay, just come back in. Right, so that is your full checkup is completely finished.
Done so well.
You did a really great job. I don't have any issues. Alright, well, I hope you, I'm just thinking, yeah, I think everything's fine. We cleaned out your ears and everything, so you're generally pretty healthy. I hope you had a good time, and we will see you again at some point in the future, alright? Okay. Thanks.